Welcome to Miss Najwa. We are from MLC and today we will be demonstrating on how to apply kinesiology tape. Before that, we would like to introduce ourselves first.
Okay, hello, my name is and I will demonstrate tapping for ankle.
Hi, my name is I will explain about rigid tapping for shoulder.
My name is Muhammad I'll be explaining about kinesiology tape knee support.
Hi, my name is and I will explain about general kinesiology tape for shoulder.
My name is Muhammad Zukri and I will be demonstrating on how to apply general kinesiology tape on wrist.
Hi, my name is Sophia. And I will be doing Edema kinesiology tape for swollen ankle.
Hello, I'm Muhammad Hakim bin Muhammad. So I will be demonstrating on edema kinesiology tapping for knee swelling.
My name is Nurman Sarah and I'll do the upper arm part.
Hello, my name is Najwa and I will demonstrate rigid tapping at ankle. So what is ankle rigid tapping? Is actually a technique used to support and stabilize the ankle joint, and it can be used during physical activities or during injuries. And let's start with our demonstration.
First of all, the foot must be positioned in dorsiflexion, which is in 90-degree position. Then, place an anchor at the top of the ankle. Add 2 strips on either side of the ankle. Starting from inside of leg, bring under the heel and up to outside of the leg. Make sure each strip overlap the other to resist inversion. Then add the figure 6 strap where starting on the medial anchor, bring under the heel toward the lateral side and cross the front of the ankle to form 6 shape pattern. And now repeat the step again in opposite direction. And that's all from me for demonstration in rigid tapping for ankle. Thank you and see you again.
Hi, my name is Fatini Afika binti Abdul Rokor and I will present and demonstrate about rigid tapping shoulder. Rigid tapping shoulder is a technique that used to support and stabilize the shoulder joint, especially after accidents or injuries such as dislocation, subluxations, or strains. It uses non-elastic rigid to limit the excessive movement. The goal is to provide stability to weak or injured shoulder and ligaments. It also reduces pain by limiting handful motions and increase confidence when doing physical activity.
Point going from the middle of the pec all the way to the back of the scapula and one around the bicep. Make sure they tense their bicep to not constrict any blood flow. Then use 4 strips of rigid tape to help lift up the shoulder and offload pain. The first strip goes from the bicep, lifting up the around detox to the front of the shoulder. The second strip is the opposite direction from the bicep, going through the detox, lifting up the shoulder to the top. Here is the part where you're going to lock off the shoulder tapping technique with 2 core points. Now, for the third strip is a straight strip up from the bicep to the top of the ankle, and you're gonna help lift up the shoulder. Whereas this second strip, you're going to really apply a force to lift up the shoulder and help offload pain. Then, we're going to strip again around the bicep, but make sure you're not compressing any blood flow when using an angle point around the bicep.
Hi, my name is Muhammad and I'll be explaining about kinesiology tape on how to support your knee. Kinesiology tape, or simply knee tape, is a special stretchy tape that athletes often use to support their muscles and joints during the movement. When it comes to knee support, knee tape helps reduce pain, improve stability, and speed up recovery after an injury. It's not like a normal bandage, it moves with your skin, allowing you to bend, run, or jump without feeling too tight or restricted. This makes it especially useful for people with sports-related knee problems such as sprains, strains, or mild ligament injuries. The tape works by gently lifting the skin, which improves blood flow and reduces swelling or bruising in the injured area. Overall, knee tape doesn't replace medical treatment, but it can be a great tool to support healing and performance. It helps the knee feel more stable and comfortable, allowing athletes to stay active and confident while recovering. In short, nice tape gives your knee a gentle boost, enough to protect, support, and keep you moving freely.
In this video, you can already see the person is sitting down with the knee slightly bent. Firstly, prepare two 25cm strips of kinesiology tape. The first piece of tape is placed across the front of the knee. The second strip is applied in the opposite direction, crossing right over the first one to form that clear X shape. This is important because it stabilizes the knee from both sides. As the tape is applied, smooth it down so it sticks well. You can notice how relaxed the person is. It is because it feels comfortable. That's the result. The knee has a clean X-shaped taping pattern that supports the joints and helps reduce stress on the muscles during sports or daily movement.
Assalamualaikum everyone. I will present about kinesiology tapping for the shoulder. The shoulder is a very flexible joint that allows a wide range of motion, making it important for many daily and sport activities. Because of this mobility, it is also more prone to injuries such as muscle strain or instability. Kinesiology tapping helps support the shoulder muscle, reduce pain, and improve movement during recovery.
First of all, tear the first strip of tape. When tearing, you can gently hold the ends so the tape doesn't curl up. Stretch it slightly. Then, apply one end just below the deltoid muscle. Gently lay the tape over the shoulder, following the natural curve of the muscle, and smooth it toward the back and front. Make sure there are no wrinkles so it adheres properly. Tear the second strip of tape. Stretch it lightly, then place one end on the front of the shoulder and gently apply it across the shoulder and upper arm. Smooth it down carefully to ensure it sticks well. Rub both strips lightly. This helps activate the adhesive and keep the tape in place during movement.
Hi, my name is Azrin and I'm going to demonstrate how to use the kinesio tape at the lower back. First, make sure your back is clean from any dust. Measure the tape and cut long enough to cover the affected area of the lower back. Cut the corner of tape to create rounded edges. This will help prevent the tape from peeling or catching on clothing. Then, apply the tape on the left side of the lower back. Press the tape down to make sure the tape smooth it out as you apply it to the skin. Use a gentle pepper of tension of the tape as you apply it to the skin and repeat the process. Apply the additional strip of the tape to the right side of the lower back. Third tape, cut the center and pull out each side using 75 to 100 tension smooth. Apply the tape and use your fingers to smooth it out and ensure that it is properly adhered to your skin. I think that's all from me. Thank you.
Hi and Assalamualaikum. My name is Wan Nabiha binti Wan Muhammad Zukri, and I will be explaining a little bit about the kinesiology tape for the wrist. Okay, so kinesiology tape for the wrist is like a flexible band-aid that helps support your wrist joint. It is used for injury prevention, rehab, or even just to give you a bit extra stability during activities. The tape is designed to work with your body's natural movement, providing gentle support without restricting your movement. Now, I will be demonstrating about the kinesiology tape for the wrist.
To start off, for the first strip, tear back your paper 2 inches from the end to create your first anchor. For this application, bend the wrist slightly to place a stretch on top of the wrist. Now, place the anchor on top of the wrist with no stretch. Peel back your paper from the middle segment of the strip. Apply the tape with light stretch along the forearm. Lay down the second anchor with no stretch using the last 2 inches of tape. Next, tear back the paper in the center of half strip and peel back to expose the middle segment of adhesive. Apply moderate stretch and adhere across the first strip at the wrist. Lay down the last 2 inches at each end with no stretch. Smooth over the full application to ensure the tape is completely applied to the skin.
For my part, I will demonstrate on how to use edema kinesiology taping for swollen ankle. Edema kinesiology tape is a special stretchy tape used on the skin to help reduce swelling. It gently lifts the skin, which can help blood and fluid move more easily through the area. This can lower swelling, ease pain, and help the ankle or body parts or other body parts heal faster after an injury. It's often used by athletes or anyone with swollen joints or muscle. So that's all from me. So first thing first, you have cut 2 or 3 strips of kinesio tape, each about 15 to 20 centimeters long. Then cut each strip into 4 narrow tails, leaving about 2 to 3 centimeters uncut at one end for the base. So for the starter, you have to place the base of the tape just above the swollen area with no stretch. Gently spread the tails down over the ankle in a fan shape, covering the swollen area. Apply the tape with very light tension, around 0 to 10%, to help lift the skin slightly and improve fluid drainage. Once all the strips are applied, gently rub the tape to activate the adhesive and make sure it sticks smoothly. So the tape can stay on for 3 to 5 days and can be worn while showering. If any itching or irritation occurs, remove the tape immediately. That's how kinesio taping helps reduce ankle swelling and improve circulation. So that's all from me. Thank you.
Hello, first of all, my name is Muhammad Luqman Hakim bin Muhammad. So I will be explaining on how to apply the edema kinesiology tapping on knee swelling. So we're talking about edema kinesiology is particularly in relation to knee swelling, refers to the applications of kinesiology tapping techniques aimed at reducing fluid accumulation and inflammation. In the knee joint, knee edema occurs when excess fluid builds up in or around the knee, often caused by injury, surgery, or conditions affecting the fatigue drainage. Kinesiology taps is designed to lift the skin slightly, which helps improve lymphatic flow and promotes drainage of excess fluid. This reduction in swelling can alleviate pain and support better joint function. The method is widely used in both clinical rehabilitations and sports settings to manage knee swelling, enhance recovery, and improve mobility following injuries or surgeries such as anterior cruciate ligament reconstruction, or we call SELR. The gentle lifting effect of the tape decreases interstitial pressure, allowing for improved circulation and the reduction in edema, which contributes to faster healing and improved overall knee function. Thank you.
First of all, before we start applying the kinesiology on edema knee swelling, first of all we need to cut 2 to 4 strips of kinesiology tape, each approximately 6 to 8 inches long, depending on size of the knee. The position of the knee, slightly bend the knee about 30 degrees to stretch the skin over the joint for proper tap applications, like the video show here. And then here we are applying the tape. Tear the backing paper in the center of the first strip and apply the center of this strip just below swollen area on the front of the knee with no stretch on the tab. Smooth the ends towards around the knee without stretching the tab. Apply the lymphatic strips. Apply the remaining strips in a fan pattern around the swollen area. Each strip should be applied with a light stretch about 10 to 20, starting at the edge of the swelling and extending away from it to encourage lymphatic drainage. Avoid putting tension on the ends on the tape to prevent skin irritation. Rub the tape gently to activate the adhesive. This helps the tape stick and lift the skin to promote fluid movement. And then the last one, check if the patient is comfortable with the tape applied on the knee. And here's the result.
Hello everyone, today I'm going to show you how to use kinesiology tape on the upper arm. This tape can help support the muscle, reduce pain and improve movement. It's easy to use and still lets you move your arm normally. So, before you start, make sure the skin is clear and dry, and always remember that the tape should not cause pain or tightness.
Assalamualaikum warahmatullahi wabarakatuh. My name is binti Raslan. So now I will tell about the purpose and the benefits of kinesiology tape for calf swelling. For the purpose, kinesiology tape helps reduce swelling edema in the calf by gently lifting the skin to improve blood circulation and lymphatic drainage. This allows excess fluid to move away from swollen area, reducing discomfort and promoting recovery. For the benefits, firstly, reduce swelling and inflammation by enhancing lymph flow, and then supports calf muscle without limiting movement.
In the conclusion, tapping is versatile and effective technique widely used to provide support and stability, and also the pain relief while promoting healing. Rigid tapping offer a firm restriction, ideal for acute injury protection, while kinesiology tapping provide dynamic support that enhance circulation and lymphatic drainage, especially useful for edema reduction. Proper application technique and appropriate tension are crucial for the tapping to be effective and safe. I think that's all from me. Thank you.